caught up on each other.
Okay.
Martell, are you getting on?
You're using old-fashioned communication, right, Christina?
Dr. Martell will be on in just a second, and it does look like we have a quorum.
Okay.
As long as Dr. Helen, are you there?
Yes, but
Okay,
I
just
don't
making sure.
I don't have a camera on this
Okay.
laptop. So,
Not a
but
problem.
I can hear you, and I'll speak up if I have to.
Okay, thank
All right.
you.
I miss seeing you, David.
Well, power is out at our house, and normally that's the computer we use. So I scrounged a laptop over here at the animal hospital, and that's what I'm using. But I guess I need to go out and buy a camera because I don't have one on it.
Well,
okay.
You're also, I mean, again, we could certainly put you up in a room by yourself, socially distanced.
Yeah. Well, if you could see me, you would know that I'm using a special mask that one of our employees made, a veterinary theme, but it is warming my chin at the moment.
Got it. This isn't too personal. Did any of you sustain any damage, from the storm? In terms of any trees down? It sounds like you lost power, David.
I did, and it's still out, and it's going to be days.
Wow.
I heard Saturday is when, from what we've gotten reports back from ComEd and the incident command, that Saturday would be the latest. I know that doesn't sound good, but
Saturday. Wow. I hadn't had a chance to be out that much, but I drove out past the corner of Mulford and Spring Brook, where the corner for Rock Valley College. And that is just horrible out there. There's so many trees down at that point. It was just, I think somebody
it's terrible.
Yeah, that there were, some trees down, but it's like there's a lot of trees down there.
And Pat was saying at the last one that she's got significant damage. She lost a significant number of her trees. That was on policy committee.
Oh. Wow. Because she lives over near Spring Creek and Mulford, just a little bit north of that, I think. So
it's interesting to read about what that derecho is, and how unusual it is. How rare that occurrence this has been. 2020 is a year of rarities.
Yeah.
It is, we were very fortunate here. We were monitoring because they had predicted some weather. We never got any of the NOAA alerts. And then all of a sudden the sirens outside were going off. We got everyone into the stairwells. We were, up until about 5 minutes beforehand, they were doing curbside WIC pickup. So that's how suddenly that came on. But we were fortunate. We didn't lose power. We didn't have anyone hurt in the parking lot or anything, we do have employees who's trees and a couple of things. And out near where I'm at, the Farm and Fleet lost their roof, part of their roof. It kind of peeled it back, and they said it blew out. Yeah, Danforth blew out windows out over there. So it seemed very, I'm going to say sudden, broad, and then kind of what you'd think is a tornado. Not every place gets hit.
Got it.
All right. We are
Hi,
all
John.
on.
All right.
Good evening.
I think we've even got more than we need for a quorum right now.
Yeah, that's right. We do.
All right.
All right, then we will call the August 12th, 2020 Board of Health Finance Committee meeting to order. And we will have the approval of the agenda.
So moved.
Second.
Second.
Any changes? All in favor?
Aye.
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 Okay. We have the July 2020 financial statements. The resolution of expenditures for July is deferred. The statement of fund balance for July is deferred. The financial review for July is deferred. The balance sheet for July is deferred. We have the bank recs for July. The general account is deferred.
Actually, we do have that available.
We have those. Those start on page 3, Jamie.
All right.
Yeah, August
we have-
15th.
Do we have page numbers? I don't have page numbers on mine.
Oh, you may not. So it's the first one behind the agenda. How's that?
Okay, sounds good.
Okay. Let me get rid of that. Okay. So July, so we have the bank recs. Does anybody have any questions on the bank recs? Pretty
No.
straightforward.
No.
All right. Then we have the revenue expenditure reports for July are deferred. The public health emergency reserve minimum graph for July is deferred, and the accounts receivable for July is deferred. That gets us to number 3, which is the major expenditure requests, which is on page 16. Is
Which is
everybody there?
Just beyond the year to date
Proposed expense.
and the bank recs.
Balance sheet for the bank rec. Okay. Number 3A, vital records, IDPH. It's the IDPH fee for electronic filing of death certificates for July. The amount is $7,652.
Move acceptance.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Passed. 3B is environmental health. The Winnebago, well, it's WCSD for the soil borings. It's in the amount of $3,600.
So move.
Second.
Any discussion? All in favor?
Aye.
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 Any opposed? Okay. Pass. Number 3 is for WIC. It's the teletask. It's the messenger service texting for the WIC client appointments. It's for $3,115.
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Passed. 3D, vital records, the international security products. It's the security paper for birth and death certificates. It's for $6,599.36.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Passed. 3E is for operations, time clock plus. It's the cloud licenses for $3,171.54.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Passed. 3F is health protections for the CDW/G for 48 port computer switches for $10,613.22.
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Pass. 3G is for emergency preparedness, RNS, antibiotics for supply cache, $6,397.50.
So move.
So, second.
Any discussion?
Yeah.
All in favor?
Whoa, hold on. I'm muted.
Sure.
Is this something we do every year? I don't remember this.
No, this is a replacement for the antibiotics that were expired. We brought this to the previous Board of Health with a different pharmaceutical vendor, which you approved, but they could not provide us in the dosing that we needed. Jim, did you want to add additional? So typically we buy them with an out date of 3 years, Dr.
Okay.
Halverson.
Okay.
So then you have to replace them when they come to their expiration date.
It didn't sound familiar at all, but I figured it was something like this. Okay, thank you very much, Sandra. I'm good, Jamie.
All in favor?
Aye.
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 Any opposed? Okay. Passed. Okay. Those are the expenditures for July, or August, as the case may be. Then we have number 4. Can you all hear me?
Yes,
Yes.
we're hearing.
You're coming in loud and clear.
Okay. I just had my
Your video's off a little bit.
Oh, okay. It said my internet was unstable. Number 4 is proposed contracts and agreements. It's on page 48. Let me find it.
And the first one is the agreement. It's there's no cost associated with it. It is the renewal of an agreement. We've had it before. Now we've got they've got a 10-year agreement. It's for placement of students by the University of Illinois, and it really should be titled University of Illinois Students in a Placement in a Practice Setting. It's for the 3 colleges at the Rockford site to place students within our facility for various clinical experiences. So this is actually the start of a new 10-year contract period.
Is it for the full 10 years or is it subject to, re-examination each year?
It's renewed. It says, according to this, when the date of execution continue for 1 year and shall automatically renew. It's on number 1 on the first page of the agreement, effective date and renewal.
Okay, got it.
So this one does not come before the board on an annual basis now.
Yep.
Okay, any discussion on this? Is there a motion?
So moved. To accept.
Second.
All in favor?
Aye.
Aye.
Any opposed? Okay, passed. The second 4B is the Health Administration Local Health Protection Grant, the University of Illinois College of Pharmacy, planning deliverables, population vaccination versus COVID-19 in the amount of $24,000.
So let me explain to you that that agreement just came in on Monday. We have the purchase order and the dollar amount. You'll see the full agreement. Charlotte is out of the office this week and we'll review the agreement. But we talked about securing them to help us with the planning section to develop our plans for population vaccination against COVID-19. And this really is to expand our capacity here. We're going to have to be looking at multiple strategies to vaccinate that are different than pandemic flu. for those, we'll go through a technical briefing at some point related to the fact that we cannot do mass vaccination, right, with COVID-19, that our models are going to have to be different. And this involves the use of, what we call contract pharmacy change. It will require pop-ups and community-based, drive-through, drive-up. And because this is going to be probably a vaccine issued under emergency authorization use, we needed some assistance and bandwidth in helping with the planning section. And so this was a group that expressed interest in working with us on, and so they would report up through our incident command to develop the plan. And we've developed the deliverables and the objectives, and so it's being incorporated into the document. And it just made it through their trustees on Monday, and so Charlotte needs to review it when she returns. But we wanted to put the dollar amount in there so that we could look at that again and prove, at least in theory, the dollar amount.
And what was the dollar amount again?
It's $24,000, and that's $2,000 a month for 12 months.
Okay. Does the group have experience with this, or something along this?
Yes, they and they have to also go through a NIMS structure training. They have done some of the planning operations. When I say NIMS, National Incident Management System, they have to be part of that as well. They were part of our team last year as part of the the Crimson Contagion. They were running and working with to develop the inventory management system and tracking that's required for the pharmacy chain management. And so we felt that this was a good reach out. And they are also engaging with students in the medical college. I mean, again, their part will be working within our structure as well as our own team. But we recognized that we needed some more, I'm going to say, some support and assistance for this planning section to devote, because we're still in response at this time.
Well, excellent. That's excellent foresight.
Absolutely.
Is there a motion?
So moved.
Move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, passed. That brings us to number 5, the fiscal year 2021 budget presentation.
Jim, did you want me to put up the PowerPoint first, or did you want to go over the budget highlights and then we can?
I'll go over the budget highlights first.
Okay.
Put that up. So I'll direct your attention to the page that has fiscal year 2021 Winnebago County Health Department position control. If you'll see, there's 112 positions with their gross wages, and the COLA comes to $5,663,525.13. And as a comparison down below for our permanent employees, last year we had in the 19 budget 108 full-time and 5 part-time for $5,445,213. And then to compare apples to apples this year, we have, for 2020, we have 106 full-time and 6 part-time that come in at $5,663,525.13. And that's exactly, well, 4% higher than the year before. So we have one less position because we eliminated 5 positions, but we added 4, and with inflation, if we did proceed with a COLA, we would be up 4%. And one of the positions we did add was at the director level for a director of policy and legal. So that's where we would stand on our permanent employees. On the very next page.
Jim?
Yes.
I'm sorry. In terms of reference to the COLA, where is that factored in to the budget?
It would be factored in the total, and all of the positions would have to be filled at the midpoint rates. And then we'd have to approve a COLA for that year for those to be in actuality. We're not approving that at this point. We're just putting the provision in the budget.
But are we, yeah, we're building it in for 6 months, correct, Jim?
Yeah, for 6 months, because April 1st is normally
Right.
we've done those, so.
So even though we might not activate it, the money is in there,
Correct,
like previous years.
yes.
Okay, just want to be sure.
Okay,
Sometimes the ground is shifting these days in ways that I don't understand.
well,
So-
yeah, and so many things are so fluid nowadays, so. But we're trying
So
to-
thank you.
Sure, absolutely.
Oh, the COLA isn't a 4% increase.
Yes, yes.
No,
With-
it's included in the total dollar amount, right, Jim? But it's at 3%, correct? Based
Correct.
on previous years.
Yes,
Right.
The 4% increase was just the 4% of the total budget, I think,
yes.
over the new total budget.
Correct. Correct. That's the difference in our, in our budgeted wages for our permanent employees.
Because there's just been some basic wage increase for year end or something, correct?
Well, yeah, yes. I mean, we've had, the 3% increase that we incur, and then plus,
Step increases that occur throughout the year is budgeted and planned for. So people that are coming up on their
longevity, yes.
Correct. Yep. I was just,
And also in the
Figured out.
past, when we had a vacant position, they budgeted at the minimum, and now pay grade, and now I'm budgeting them at the midpoint.
The midpoint. Good.
Mhm.
So that way, if we have somebody that has credentials and experience that we desire, we won't blow away our budget. So it is fairly conservative, but factoring all that in, we're going up 4 percentage points in total. And then on the next page is our roster of our contact tracing team, which is for the 1 year with no COLA, because they wouldn't be eligible, and they are temporary employees, but they will get benefits and everything else. But that in total is $2,340,503.65, and that's for the 51 people that we have in our plan covered under the contact tracing grant. So is there any questions as far as the position control and the calculation? Okay. On the very next page is an analysis of our revenue source, and the very right-hand column that's blue is what we had anticipated for 2020, and then in yellow is 2021. And so it's the various programs, and we've kind of gone over this before. I would, as a comment, direct your attention to the very bottom line where I have the local cure funding, which is the recent addition to this. It's for coronavirus urgent remediation for emergency, and it expires December 31st of 2021, and it's for eligible expenses starting in March. So as much as I could choose to, I'd have to take, quite a bit of those dollars in 2020, and then some in 2021. So that's my best guesstimate at this point as to how we would take those in, so that we'd be sure and make full use of those resources that are available to us. So
the main increase there is basically the contact tracing part of the budget.
right, pretty much so, yes. And then some of the local cure allocation.
Right.
Because we were allocated almost 540,000.
And that came through our local health protection grant. So right, Jim?
Right.
So
Right.
yeah, so when we talked about that contract that we have, like that we went for the planning section, that is coming through the local health protection grant as well. So we've got the dollars to offset it because it's related to COVID expenses.
No questions concerning the figures, just kind of a general. Looking over the fiscal year 2020 monies and the 2021s, there are several which have some significant drops. Obviously, the Ryan White we're no longer doing as a group. Is this a trend that we should be noting with concern? Or no, this is kind of a regular fluctuation, and I've just never really looked at it in this type of a setup.
Well, is with regard to specifically the Ryan White, we were the lead agency.
Right. No, that
Right,
one I
we
understand. But I'm looking at, let's see. Let me see. Just
HealthWorks, you want to probably take a look at, because HealthWorks,
yes.
and let me explain that one to you. So for those of you, that's kind of similar to the Ryan White in the sense of the state in the past contracted with the local health departments in a regional perspective to manage DCFS wards of the state. If you've been watching the news on the managed care, they are now moving that to a company, Centene, and they have a division of that is going to take on that piece of it. So we will continue to retain the case management piece, but not the network. So, I mean, is that a trend? Hard to say on that one, but it's not something we competitively could bid on. It's not something we lost because of a performance issue. It's related to how the state was going to envision that program moving forward. Some of these, as you take a look, like the census, obviously will not be happening in the next fiscal year.
Right, but like teen pregnancy, say a drop of $120,000.
Well, and that was related to, that demonstration, the TPP grant that we got through for that 3-year funding cycle. And so we went through year one, and it required in-school education. The feds are pulling back on that, obviously, based on the limitations in in-school programming. So we're doing a more electronic version. And so they've reduced the funding in that regard. And of course, we pare back the expenses at that part. When you look at some of the others, it's relatively stable. I think that typically, like the dental sealant, if we can exceed it, and that'll be another one to watch, right? Because that's provided in school, and it's pretty much pass-through money to that program. But if we end up not having as many students in school, we're going to have to look at the alternative methods for delivering that program. In terms of large sums of coming out, I think the interesting thing will be, as similar to, like the smoking monies, the tobacco, we're always going to have to watch that COVID line, because that's not going to be there forever, right? So we have to be thoughtful that this temporary bump, which results in a temporary increase in staffing, also will trend out as other things come into the forefront, right? So you remember the decline in West Nile virus funding, and so now that's linked into the local health protection grant. You see a reduction in the tobacco funds that came out of the tobacco settlement monies. You might see an increase in the opioid if they settle on that one, might come through local health departments, but we got an increase this year in the surveillance portion of that, as well as some of our prevention funding. I think that the concern would be anything that is significantly tax-based, sales tax-based, is a concern. Our levy and our referendum is real estate. Anything that's coming out of the general revenue fund at the state might be subject, as the revenues coming in from sales tax may be down. On some of these issues as we move forward. I think there's growing concern regarding the healthcare costs. Every year that becomes an unknown figure. So personnel is typically the largest expense that we have. And so as we pay, as the cost of that increases, being able to absorb what we can, right, becomes, and I think that was why we went and made sure that everyone's aware that these COVID contact tracers are temporary. And hopefully that some of them will decide to retain or maintain on, we typically have some turnover rate within the department that allow them to come in there. Is there any other one that stood out in your, because remember, teen pregnancy was a startup. We didn't really get very far in that grant when it started.
Right.
Well,
I
the-
guess
Yeah.
it just I guess several of them jumped out at me more, I think, before this was finalized. Maybe these were the numbers, but I just wanted to be sure because I noticed that most of our increase was based on Corona and some had definitely dropped. So I just, I'm sure you guys monitor this much closer, but I just want to make sure this wasn't a trend we were seeing through government cuts and scaling back on some of the programs that we have. And if that was a concern we needed to have, but it sounds like,
Yeah, because we, like this, the home accessibility program, the whole grant was 170,000, but they weren't able to, we don't figure they're going to be able to do much, but tap maybe 35,000 into that in 2020. And so the remaining portion they'll be executing in 2021 of 135. And with regards to the HUD, we were closing out an old grant from 2016, and we had a push to do some healthy homes portion of that. And we did the best we could, but the next year is just an appropriation based on our 3.5-year grant with HUD. So we just kind of annualized the revenues over the 42 months and determined that that would be a good target for 2020. So even though those two line items look like deductions from one year to the next, they're really not. It's just, a lot of the awards we're not going to be able to take advantage of in 2020. So while we do have concerns, it's not, it's nothing that is an alarming trend.
nothing that's out of the ordinary with the regular flow and such. All right, thank you. I was just curious.
Okay, and the next page is the expenses for the health fund, and they have 5 columns there, which is the fiscal 19 year actuals and where we stood as of June 30th, and the second column in yellow, our 2020 budget that we have in light green there in the middle. And then the fourth column over is the projected finish for fiscal year 2020 for our expenses, and then the proposed budget for, well, that should be 2021 and that final column there.
Yeah, I was going to say, is that?
It's labeled as 2020. I'll fix that up. So in those particular numbers, you'll see the regular salaries there at 5,000,006 ties to that schedule we had for position control, and then the temporary salaries tied to the contact tracing team. And then you'll see a couple lines down, I have 1,858,000 budgeted for health insurance, which is almost double as to what we expect to incur this year. So there is some provision in there for some increased cost and obviously more volume with more employees. And then throughout the expense lines here, we tried to be realistic and determine which expenses won't be repeating, but then for like, I can, if we want to move on to like the actual personnel costs would be in total with benefits, which is that second line below on the far right-hand column, $10,667,000 for 2021. And supplies and services would be almost 3.3 million, about halfway down the page, highlighted in gray.
Any particular reason that's highlighted in gray?
Well, it's just a subtotal of all the most expenses that are not related to personnel specifically.
Okay, thank you.
Yeah. So. And then on the second page, you'll like we have other professional services of about 2/3 of the way down, which is 763,000, which is related to contractor fees for HUD and some consulting fees. And on the next page, we have about 2/3 of the way down building rental, which is our contribution to from the contact tracing grant to pay for the rental space on the third floor. That's almost 495,000. And then on the very next page down on the bottom, we have other expense transfer to other funds.
And Jim, can I stop you on I know that we've been talking as well about that building rental also being some early repayment back on the bond.
Yeah, that's more addressed. Yeah, on the next page where I have transferred to other funds, which is $350,000, which would
okay.
Go, yeah, it's on the very bottom, which is essentially transferring our, what we would consider our surplus, to the building fund for them to do repairs, maintenance, and debt service. So it's under capital outlays, and then below that is other expense in gray, 350,000 on the bottom of that page. So essentially, it's our surplus that we're going to transfer to that so that they can fix the elevator. We can do various repairs to the building, and and leverage some of these resources that we're going to be collecting this 1 year. So.
What was the cost on the elevator again?
We had a number of about
Estimate.
204,000,
How much?
208,000 with the new car and the electrical work that they have to do. So that was our guess from Sean Franks, the facilities director.
Okay, thank you.
So in total, on the very next page is a summary, and I'm anticipating, if we want to direct our attention to the two right-hand columns, the projected fiscal year results for 2020. I think our revenues will come in about $9,727,250, with expenditures of $9,212,000, which would leave us with a excess or a surplus of $514,882. And then for 2021, we're proposing a plan for revenues of $14,383,000 from that other schedule, and expenses of $14,326,867, which would leave us with a slight surplus of $56,615. So, I mean, it's obviously everything's fluid, but as right now, I mean, that is a pretty solid number and a good number to start a plan from, and that would be for the health fund itself. So, does anybody have any questions or?
Just curious, since we're moving to the end of 2020 fiscal year, how close are we to that 514,882?
We're actually pretty close right now. So I'm anticipating if we, break even the final quarter, that we would make that number. It might be higher than that.
Fantastic.
Yeah. So on the next page is the fiscal year budget or plan for the North Court Fund.
I guess question to the group is, do you want to make a motion to approve this budget to advance to the board? And then we'll take the 555 North Court.
You've got adoption listed on the
Right.
agenda, so I assume that's what you were looking for.
Yeah.
Yeah.
Right. Just halting the group for a minute here, just before we go racing into the next one.
Okay.
I move that we accept the revenue and expenses, the budget for the health fund for 2021.
Second.
Any further discussion? All in favor?
Aye.
Aye.
Any opposed? Budget moves forward. Next, 555 building.
Okay, and then on the next page, I have what we had in fiscal 19, where we're at in June with our expenses, and the budget that was for fiscal 2021 or 2020 revised. And then the fourth column is our projected fiscal year results for 2020, and then the 2021 budget in yellow in the right-hand column. So there's $625,000 in total expenses for the North Court Operations Fund. If you'll note, midway down the page is the building repairs and maintenance, which I had the budget revised in the green to be $136,000. I'm anticipating with some of the electrical work and the painting and the carpet that would be up towards $124,000 for 2020. And then there's $80,000 in their normal budget for various things that happen to these types of buildings. And then we have capital outlays of $220,000, which should be covering the elevator. And then an other expense of $175,000. Now, transfer to other funds is actually an income to them because they have a $296,000 debt service, but they'll be getting $350,000 incoming from the health fund. So that's a negative or an income, a net income for the building fund. And then they have depreciation, which is non-cash. So on the next page, I have the summary, so for the building fund, they'd have rental income of estimated at $622,000, and then expenditures of $625,900, a very slight excess or deficit of $3,800 or $3,900. So. Are there any questions on this fund? It's pretty much bolstered by the rent that we're going to be able to pay, and then our additional transfer that we're going to get from the health fund to the North Court Building Fund.
Right. Are we looking for an adoption on this one also?
Yes.
I did the last one. Who's going to pick up the next one? I picked up the big tab, folks, so.
So moved. Move to approve the 555 North Court Fund for proposed for fiscal year 2021.
And to tag further, I second.
Any further discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, we'll move it forward.
So as part of the board meeting, we will have the narrative like we normally do to kind of give the highlights so that we can move through it. We do have, Jim, did you want to show it tonight? I can pull it onto the display screen. See how this works.
Yeah, that's up to you. I'm fine.
The other part I wanted to let the board know, we have gotten a proposal for what we call the phase 1 environmental assessment for 401 Division Street. So they just came in today, hot off the press. There is a major expenditure that will go with it for the assessment. And we will, in terms of the asbestos and the phase 1 and then the analysis budget. So we're going to move forward with that. But we got the proposal from the county's agent that does that work. So you'll see that as a new major expenditure on the Tuesday night. We didn't get it in time to be able to put it forward. Okay, now I'm going to try this. Yes.
Just give us a ballpark of what we're talking about.
Sure.
It's sort of nice to have a preview of coming attractions.
Preview of coming attractions. Let me get, of course, I'm going to have to get my handy dandy calculator the old fashioned way.
This is just a rough, I don't want to bite off too much, of the agenda. I was just curious for a ballpark figure.
Ballpark is $6,450. And that includes the phase 1 ESA, which is the environmental site assessment, task 2, which is the limited asbestos screening, and task 3 is the lead screening, includes the labor, and then the analysis budget is $300.
Okay, thank you.
Do we have any asbestos concerns with that building?
I believe you do.
You do.
You said that very hesitatingly.
It was located in the clinical space that you refurbished. Remember, you covered it. You did
Really?
All the little 9x9 tiles. Yep.
You appropriately sealed it, but again, remember, this is part of the, again, the assessment. So they're going to go and they're going to take apart those areas, but you did have it. Todd Marshall was aware of it. It was, I think, part of the old clinical area. And then, yeah. So that's what I know. Now we'll see if it proves up, right? Maybe it's a surprise. Maybe it was urban legend. So we'll see.
Okay. Thank you.
You never know.
Thank you.
Thank you.
All right. So I'm going to see if I can get this to work. I guess I get to share screen. Is that what I do? So
Yes.
Stay tuned for the
Yes.
fun. All right. I have screen 2. Can you see it?
Yep.
Okay, I'm going to
Yes.
take you to the first one. Let's see if I can get to the top. Slideshow. Oh, sorry, Angie.
It's okay. Now, let me see if I can get back on. Hold on. Approved FY 2021 budget. Gotcha. Got you back.
All right. Yeah, I have to admit, we apologize. A lot of as you would guess, we have the elves deliver after hours. We're still very actively engaged in response. So we don't change this up. As you know, it's pretty much reminding our board and Winnebago County Board of what we do. And we have a new administrator that will be starting at the end of this month. And so will be part of the budget process hearings. A reminder of what our core functions are in terms of assessment, assurance, policy development. That's especially important as we talk about why did we add a position in this year, what kinds of things we've been doing in the COVID response, our authority to do this. And I guess now we'll have to add that whole new section in from the act. You all know our strategic plan. You can do it off,
Have we seen this before?
this, the new format.
I'm kidding. I'm kidding. I'm
You may
sorry.
not remember the green and the beige.
No, right, but I'm sorry.
No problem. Again, you think about some of the focus on core public health we've had to do. Now we've added the COVID-19 surveillance that's becoming almost a daily. This has been something kind of examples of what we've been doing over the past. So just so we know, monthly reports on local perspective, you'll be seeing the June-July report at the Board of Health meeting on Tuesday. And again, kind of those weekly press briefings. Advocating for policies, we kind of focused on the COVID response and the 3 core functions. So that's what you're seeing here was what kinds of policies did we have to do? And so we'll update this to reflect a little bit more. We had the alignment of the food code ordinance, development of policies to support public health behaviors, facilitation and development of community standards. And these are the guidance documents that we've developed that are available on the website. And again, this kind of development of plans. So we highlighted what we've been doing, whether it's the Joint Information Center, the Incident Command Structure, and we'll send this out so you can review it and tweak it. I know all of you have your favorite sections when we bring this up and where you think we need to enhance it. I think the biggest one, again, you think about some of the things we've had to do. It was, and you think about just the short amount of time that, coordinating with the EMAs, activating and training a medical reserve corps that we had to support contact tracing, and we wouldn't have been able to do without them, and supporting notification of results from the Auburn community-based testing site. That is something we've continued to do. Our health priorities, we are still in the assessment process, kind of in that final phase, but up until this point, we still have our 3 health priorities that we're still focused on: maternal and child health, mental and behavioral health, and violence. This is just a reminder of the objectives. You have seen these before, but it's a reminder to the group in the county that doesn't look at them very often, who thinks this is all new, that these are things that we've continued to work on and why we are concerned about things like violence in the community, whether it's the homicide rate, exposure of children, incidents of firearm-related deaths. Some of the community level strategies, the trauma-informed community work. I reminded one of our commissioners today about the opioid response team, the adolescent pregnancy worker, the behavioral health leadership, which was formerly the mental health advisory committee, now is kind of morphing into the mental health, and then the early learning council of the Rockford area, ELCRA. So last year we gave a little bit of update of why ACEs were such an important initiative that the health department had continued to work on. And I remind them that even as we come out of COVID, we're continuing to work through some of this. I know that's been a big discussion with the schools about how to prepare for children who are returning, and teachers and staff. The amount of trauma that's occurred in the community as a result of the pandemic and the associated, some of the civil unrest, some of the discussion and dialogue, the politics, all of this, that's part of the national dialogue, and what's the concern around children returning to environments. We know that some of them are already kind of frightened to come into some of this environment as they return to school. So there is, financial stresses on people who may have lost or been impaired in their jobs. And concern we have with remote learning was the poor academic achievement, that it's been highlighted through that. And I have to mess with this. We don't need all that fancy stuff. Okay. We talk a little bit about the mental health initiatives we've worked on. We now would be talking about how we are continuing to work with the mental health committee. I know Jim already has had a meeting with them to help them work through, or is planning a meeting with them and the county administrator to plan their budget as they move. It's tomorrow. Yeah, fiscal year 20, their first budget as they go through. But some of their other ones, the Winnebago County Opioid Response Team, we've continued to work on that throughout this pandemic. We'd like to be a little further along on that. And the trauma-informed community. And again, this is a very high-level overview meant to kind of support what we have in our budget. So that's where we led with the COVID-19 and the initiatives that we're having to do around that, because a significant portion of funding increase this year came from that. Reminder of what we've been doing on the opioid response team. And this does the comparison that Jim put together on the funding. And this is something we look at every year. The changing pie grants. You can see this time around, and I'm not comfortable when we get too heavily grant funded, but I don't think we can do much about that. To Dr. Halverson's point, if the state or the feds were to withdraw any kind of grant funding, it makes our stability, with greater impact, because right now almost 72%, right, or almost 0.75% is coming now out of grants. The things like the levy kind of declines a little bit, but it's just, proportionate. And obviously fees and permits, we're estimating at 8.5%. So down from 11% as businesses and as we have not collected some of the fees and permits that we would normally collect due to the reduction in business at this time. And Jim, weigh in at any point. I don't know. Do you think it's beneficial to include 18 and 19? We left it in here, but that's almost a 4-year.
Well, yeah, and then our changing to 2021 is primarily that contact tracing, the 4 million, which we have temporary staff with that. So I probably should, maybe I could pop one in with it and without it, so that we're actually comparing.
It might be a good way to right show that.
So
that might be more helpful.
Right. I think I will do that, and I'll change that slide. The previous
Good.
one. Okay.
Because I think after a while they just.
That's the levy funding.
The levy fund.
Level, yeah. So
a little bump up in 2018.
Yeah.
I guess the trend analysis, you can see this is where you start to see the change in the grant, right? We're going from, our grant sources of funding have increased, and maybe it might help to put the two together, Jim.
Yeah, maybe a stacked bar.
A stacked bar, yeah.
Mm-hmm.
And I apologize because Jim and I, haven't had much time. Medicare and Medicaid, I really want to be cautious about this because our primary job is not clinic service delivery. So we have to be cautious about when we present this because it's not that again, we're not big in the clinical services billing. So this is where this is being generated from. And so again, is it a function of, who's coming in or how many people coming out? I guess the monitoring would be, is if for some reason we had a sudden increase in Medicaid populations because they could not get services elsewhere, and that would be predominantly in the immunization areas and things like that. Fees and permits. I think this is important to understand, and I think the other part that we have to kind of look at some point with Todd as well is number of establishments needs to be wrapped across this. Partly because remember we changed to a more scalable permit for some of special events, right? We gave them that zone and did that impact it? But concerning obviously is as we get to this lower area, the concern will be as we don't permit as many events. For instance, we just got a request for a big event at the demolition derby at the Pecatonica Fairgrounds. Well, first of all, we can't endorse an event that gathers the number of people are going to have there. So we are not going to be issuing permits for food vendors that would normally have been there. Maybe there'd be 10 or 20 food permit vendors that would be there. So it's a source of lost revenue, but of course the work effort, it's really intended to collect the work effort. So I don't even want to think that this is just, remember our fees are associated with the amount of work that's required to do those inspections. So probably sometimes when you show this, it doesn't really reflect that, but that is what it is. This is all three of them combined. So again, you see the big jump up is the big blue, which are the grants. You see the yellow being the levy, fairly stable. Fees and permits, fairly stable. So again, the big jump again, and maybe this is the one you showed, Jim, rather than all the separate ones.
Yeah.
What does the group think? Do we need?
This looks good.
I think that's a good representation.
Do we
Yeah,
need?
I like this summary,
Okay, do we need all the individual or just the summary?
Just the summary.
the summary.
Summary should be
Okay.
good.
Gives us the year, the amounts, yeah. That's good.
I like
I
it.
can understand that. If I can understand that, everybody will.
Blue
yeah.
going up, yellow staying the same, red staying the same.
Gotcha.
I don't know what this purple is versus the black, Jim. You'll have to.
I don't know.
It's the other.
Yeah, you'll have to look at the color coding on that. It might just be my computer screen too.
Oh, I have it.
And I think we need to take a look at this, Jim. Fourth quarter revenue risk due to grant contracts, which may be discontinued or renewed for a lesser amount. We didn't see that, so I'm not going to put that up there. I think the more, I think that we're going to continue on this difficult fulfilling grant deliverables due to an increasing tight labor market. Despite the fact that we have open positions, we still compete. And even Jim had a position where the person probably was recalled to their former position. And so we end up being a little bit of a revolving door. This still isn't out there, federal dollars related to Title X family planning and refugee health services and vaccines for children. It's unclear what that will look like if there's a change in policy as we move forward, or if there will be any attempt, if the current, depends upon administration changes as we go into the election and then who goes into office after that. But those would be the most risky, are the federal grants. I think this concerns revenue. While we got bump ups for COVID, we still are underfunded in the infrastructure in general for public health, which is what, why they had to give us cash infusions as we tried to ramp up for COVID-19 contact tracing. Maintaining competitive fees for environmental health right now, as we know, they're not too happy with us going out to inspect them. And now with masking complaints, they probably are less happy about that. And so it's that balance of customer service and making sure that we're actually recouping the cost and at the same time ensuring compliance. I think we've really seen the continuing impact of the Affordable Care Act. I think we probably can start moving that. We're not seeing our healthcare providers in our community. For those of you who don't know, UI Health now joined with Miles Square FQHC. So now we have really 3 FQHC providers in Winnebago County, Crusader Community Health being still the largest and most established, and Aunt Martha's associated with Swedish American. And then now we have Miles Square, which is associated with UI Health. So again, kind of interesting as we move through some of that. So at least now we have capabilities for medical homes for clients. Despite the fact that Mercy may not be renewing its contracts, and that's still in discussion and debate, we still have 3 solid federally qualified health center providers with significant backup. Delayed reimbursement or non-payment for Medicaid managed care entities. And I think we've seen less and less of this as we've gotten that structured out and we're credentialed with the appropriate ones. But this is an ongoing discussion. We always talk about the grant revenues, level funding. We still don't get funding, let's face it. We get the emergency funding for COVID, which is the activity du jour, and the problem is, though, we're still not getting things for like the trauma informed. We're not getting funding for suicide, adolescent pregnancy, and opioid crisis. We get some targeted monies, but again, overall, these become like, how do you sustain the community activities related to those? Loss of fee-based revenue due to COVID-19 pandemic, we kind of talked about. Inability to sustain grant deliverables. We were fortunate this year, in this fiscal year, but I think that the pressure will be on us because we've received COVID funding that we are going to have to make sure that staffing is going back into the programs for which they were intended and or staffed on. Both DHS and IDPH allowed us to collect our fees this year without, recognizing or responding. But as we move forward, that will be less likely moving forward. Our still levy funding, as I come back to, you get $8.38 or as a resident of, and we're still basing it on our 290,000 population at this point. And we're still in the open market. We don't know what a dose of vaccine is going to cost us for COVID if we had to go out into the market. I probably don't want to know about that. And so, again, we'll take a look and make sure these were the same numbers. There was nothing really new updated on those and what it costs, because I think people need to understand no one's getting rich here, but we are a referendum based, which is when I talk a lot about some of the concerns that we've had, as you've seen some of the kind of reach out from the state to fund community-based organizations for contact tracing. My concern is at the end of the day, my population will hold me accountable whether or not there's a community-based organization that's going to do it in my community, right? If they fall down, I'll be expected to pick that up. And if they allow an outbreak to occur, that will be part of the responsibility. And that's been an interesting conversation at the state level that we're having. We have increasing contractual costs for services and supplies. Who knew an elevator could be almost close to $250,000, right? To replace an elevator. Implementation of plans, public health incidents, emergencies. We've been fortunate, just so you know, West Nile looks like it's going to be not with the amount of rain and washout we've had. Marshall and Kisner reported that we've not had a significant amount. Of course, now we're going to watch for foodborne illness post refrigeration issues that occurred. And again, we still have had a TB case and several linked cases related to one of our workers in a food establishment during COVID as well. So, which resulted in an investigation of a fairly large footprint of a restaurant and a food establishment with testing and then follow-up and latent TBI treatment. So, and we've put this on for how many years? And of course, emerging infectious diseases, it's not just COVID. But again, watching that. Environmental health, we continue to have issues with aging infrastructure. Think about the power outages and the lines and the bearing and what that means for some of our areas that rely for pump stations and things like that. If the lines aren't buried, these kinds of storms and things become lead, blighted properties, wells and septics, natural disaster. And of course, Dr. Holland's favorite, he always wants to make sure I end on a positive note, a bioterrorism event. Oh. So hopefully that does not happen. But again, kind of looking at that. Increase in personnel costs. I think one of the things that I'm going to have to do that we're going to have to take a look at is management, making sure we're competitive as well. Management of 555. Thank goodness we got our tenant as ourself to increase. But again, as time goes on, continuing to maintain that. We rely more and more about IT support. We look at computers are constantly being replaced. You saw the switch come on. We needed to replace a switch. We've done had to replace some everyday operating equipment here. We have high standards for public health reaccreditation. So, we have ongoing expenses related to making sure. We did not get through our website redesign this year that we had hoped for to end at the fiscal year, but we've still got it as part of our ongoing need to do a massive update to our website and redesign to make it much more interactive and fluid. We're still very static. And we are still in our process of completing our community health assessment and community health improvement process. So as I look forward, we don't know if additional funds are going to be coming through, but mounting the mass vaccination campaign for COVID-19. Even on a good day, we're going to have to do some of this upfront expenses that we've had to associate with that. And I think Jim did a great job, and we've got as much money as we can up front, but some of these things we've had to kind of pull together with the idea of how do we get it outside of that so we can begin those processes. Increasing in cost for personal protective equipment, the cost of hand sanitizer, gloves, paper towels, just like everyone else in the home market, the cost of what we used to pay for. And increased loss of productivity, and I'm going to say the cost of benefit time, and maybe we could spell that out a little bit, is that when we have to quarantine someone because of an exposure, so they're out in the field, we find out they're a close contact, there's an exposure, we are on the hook for their 14 days of quarantine, right? We can't, as an employee, and we certainly respect and do that, but that's time that they're not available to do their job that they're normally assigned to. So we'll assign them other work to do, obviously, but it may be if they're supposed to be a field inspector and do, 6 establishments a day, that's lost productivity that we don't have and that we can't recoup. But again, this is part of the ongoing process that we're going to have to look at with the pandemic. So we talk about the COLA mid-year. We had hoped to be able to offer summer hours this year, but nobody could nearly get out of regular hours. At this point, most managers are in 10 and 12 hours. Making sure that we're recouping all of our costs, fee structures, and always looking for sustainable funding sources. I know that Jim and his team works really hard to make sure we have implementation of control on grants. We continue to leverage our partnership in community health so that we can leverage our resources. So for instance, one of the areas we're exploring just as we went through is, for instance, part of our emergency preparedness dollars were used to rent storage lockers, right? We stored equipment there. We are looking at a partnership with the county to work with the Salvation Army to have them provide logistics support and warehouse maintenance, right? So that we're leveraging our dollars and really being able to put a benefit back in the community as well. So some of that, as an example, we did that with our community health improvement plan. Disposition of our Division Street facility, you're going to begin to learn that. We're going to continue to apply for AmeriCorps program, folks, as those people become available. There's been kind of a little bit of a stop right now to bring individuals from outside. Alignment of our resources, and then expanding educational and internship opportunities. So our goal is to maintain our public health reserve to address our public health emergency. And Jim, you're still at 1667 a resident?
I have to recalculate that.
I think you do. Yeah.
Yeah.
I don't think you got to that. So we're going to go through, I don't think you put the new ones in here yet, Jim, right? You just did the charts.
Right.
So we're going to fix this up for our final, make sure as we typically do to give them that. And that's just to give you an idea. So if you have thoughts on what else you think we need to include so that people can understand where our budget's coming from, why the numbers reflect what they are, we have time to tweak that portion of it.
So a copy of whatever the latest draft of it, after you've done the tweaking, will be part of the budget packet that we get.
Correct.
For the meeting next week.
Correct. So, and I'll have Christina send this out tonight as well to all of you so you can look at it and send any feedback or comments that we can take a look at. And did you tweet the 555, Jim, or just this one?
Just this one.
Okay. All right. All right, so I'm going to stop sharing. Okay, now I come back this way.
Hey, that works out good. I got you back. How about that?
Yeah.
Right.
When it works great. When it doesn't, it's very frustrating.
Good job on it.
Good job. Good job.
Yep. Real good job.
Excellent.
Jim did a great job.
Yes, thank you, Jim.
Thank you.
So we'll send that out, and then we'll be ready for our board meeting on Tuesday night.
Okay.
All right.
I assume this will be the main focus of the meeting on Tuesday, correct?
Well, we say that and then, I know that there's been
Oh,
a
come on.
request for a
Come
COVID. I know that Peter is going to do a 2-month trend analysis. We're going to be presenting the data through July on COVID as
That would
part
be
of the
good.
presentation, but then this will be the focus, which is why we wanted to get through the major expenditures today.
Okay.
Yeah, and then the budget will be all the fun and games, right?
And we should be able to move through the finances fairly quickly because we did our work
Mhm.
tonight, right?
And policy did their work as well.
Okay.
So they looked at 2 things as part of the policy agenda, the resolution that you requested at last month's board meeting on the masking or face covering, and then a sample MOU with the city of Rockford for enforcement activities related to their ordinance of masking.
Okay.
So that's all we have for finance, Jamie, Madam Chairperson.
All right, is there a motion to adjourn?
So move.
Yeah.
Move that.
All in favor?
Hi.
Then we'll see you all on Tuesday.
Stay
Yeah,
safe,
Tuesday.
everyone. And if you
Stay
need,
safe, be
everybody.
well.
yes.
See you next week.
All right,
Bye-bye.
Dr. Helland, if remember, you can come and hang out with us. We'll